Hello, I'm Dr. Divya from the Department of Prosthodontics. Today we'll be learning about minor connectors. Minor connectors are one of the components of cast partial denture, and it can be defined as the connecting link between the major connector or the base of the removable partial denture to other units of a prosthesis such as the clasp assembly, indirect retainers or rest. This definition is from GPT or the Glossary of Prosthodontic Terms and the 8th edition of that, which you're supposed to be following. We will be discussing about minor connectors in the topics given on the left side of the screen one by one. First, let's dive into the functions of a minor connector. As the definition suggests, its important role is to join the components to the major connector. Other than that, it also does or serves two major purposes, first of which is prosthesis to abutment function. That is, it transfers functional stresses to the abutment teeth. The occlusal forces applied to the artificial teeth are transmitted through the base to the underlying ridge tissue, if that base is primarily tissue supported. The occlusal forces applied to the artificial teeth are also transmitted to the abutment tooth through occlusal rest. The minor connectors arising from a rigid major connector make possible this transfer of functional stress throughout the dental arch. The second function is transfer of the effects of retainers, rests, and stabilizing components throughout the prosthesis. This is the abutment to prosthesis function of the minor connector. Thus, forces applied on one portion of the denture may be resisted by other components placed elsewhere in the arch for this particular function. A stabilizing component on one side of the arch may be placed to resist horizontal forces that originate on opposite side of the arch. This is possible only because of transferring effect of the minor connector, which supports those stabilizing components, and they are rigidly connected to the major connector. Let's learn what should be the form and location of minor connector for it to fulfill its functions. First and foremost, it should be rigid. Otherwise, the transfer of functional stresses to the supporting tissues and teeth will not be effective. A minor connector that connects the axial surfaces of an abutment should not be located on the convex surface. Instead, it should be always located in an embrasure where it will be least noticeable to the tongue. When a minor connector crosses the gingiva, it should be abrupt so as to cover the least amount of gingival tissue as possible, and it should be thickest towards the lingual surface, tapering towards the contact areas. The deepest part of the interdental embrasure should be blocked out so as to avoid any wedging effect that could be produced by the minor connector. When a minor connector contacts tooth surfaces on either side of an embrasure in which it lies, it should be tapered towards the tooth and should avoid sharp edges as they hinder the tongue's movement. Minor connector that contacts the guiding plane surfaces of an abutment, whether as a connected part of a direct retainer assembly or as a separate entity, must be wide enough that the guiding plane can be used to its fullest advantage. And when it rises to a clasp arm, it should always be tapered towards the tooth. These There are four types of minor connectors. First, minor connector that joins the clasp assembly to the major connector. Second, minor connector which joins the indirect retainers and auxiliary rest to the major connector. Third, which join the denture base to the major connector. And finally, minor connectors which serve as an approach arm for a vertical projection or bar type clasp. We will discuss about each of them in detail in the coming slides. Minor connectors that join the clasp assembly to major connectors must be rigid because they support the active components of removable partial denture, that are the retentive clasps. They also support the rest, which prevents vertical movement of the prosthesis towards the underlying supporting tissues. As a result, these should have sufficient bulk to ensure rigidity, but they must be positioned so that they do not irritate the oral tissues. They should be always located on proximal surfaces of the teeth adjacent to the edentulous area. They should be broad buccolingually but thin mesiodistally. When these minor connectors are not able to be positioned next to the edentulous area, they should always be positioned in association with the lingual embrasure. This results in sufficient bulk without encroaching on the tongue. The minor connector should never be positioned on the convex lingual surface of a tooth where its bulk will be very evident to the tongue tissues. The second type of minor connectors join indirect retainers or auxiliary rest to the major connectors. They should form right angles with the corresponding major connectors, but the junctions should be gently curved to prevent stress concentration, and these should always be positioned in the lingual embrasures to promote patient comfort. The third type of minor connectors are those that join the denture bases to the major connector. There are three types: open construction, mesh construction, bead, wire or nail head components on metal bases. We will discuss about each of them in the slides coming. Some of the common properties or requirements of the denture base minor connector are: they should be strong enough to anchor a denture base to the removable partial denture framework. They should have minimum interference when trying to arrange the artificial teeth. On the maxillary arch, they should extend the entire length of the ridge and should cover the tuberosity. That is, they should extend as far posteriorly as practically possible. And on the mandibular arch, they must cover the retromolar pad and extend 2/3 of the length of the edentulous ridge. Relief area is provided beneath denture base minor connectors. This relief provides space for the resin to encircle the minor connector and provide a mechanism for attachment of the denture tooth to the framework. In distal extension cases, where distally there is no tooth support, during the packing and processing of acrylic, there are chances of the minor connector bending. To prevent this, a small area at the free end of the minor connector should contact the master cast. This is called as the cast stop. The cast stop is created by removing a small square of relief wax about 2 × 2 mm in area, where the posterior struts of the minor connectors cross the center of the ridge. This depression is incorporated into the refractory cast. During the waxing process, this depression is filled with wax. Upon casting the framework and returning it to the master cast, the cast stop should contact directly the surface of the master cast. This prevents the bending of the framework and minimizes the distortion of the framework. Open construction consists of longitudinal and transverse screws that form a ladder-like network. In the mandibular arch, one longitudinal screw should be positioned buccal to the crest of the ridge and the other lingual. In the maxillary arch, one longitudinal screw should be positioned buccal to the ridge and the border of the major connector acts as the second one. The longitudinal screws should not be placed on the crest of the ridge as they interfere with the placement of the artificial teeth and predispose the denture base to fracture. The transverse screws should be positioned to facilitate the placement of the artificial teeth. When vertical space is minimal, improperly placed screws may create difficulty in tooth placement. Ideally, it should be designed to pass between the necks of the artificial teeth. This aids in tooth arrangement and often improved aesthetics. Master casts that are to feature open retention must be relieved with an appropriate thickness of wax. Relief provides space for the completed minor connector and tissues of the residual ridge. The space permits an acrylic resin to encircle these screws, thereby providing retention for the denture base. Open construction is used whenever multiple teeth are to be replaced. It provides the strongest attachment of acrylic resin and also facilitates relining and rebasing of the cast partial denture. The second type of denture-based minor connector is the meshwork construction. It may be compared to a rigid metallic screen. This allows the resin encirclement of the minor connector and mechanical retention of the denture base. The relief and border extensions of mesh construction are identical to those discussed for the open construction. The most important drawback of this type of minor connector is difficulty in present during the packing of acrylic resin. Increased pressure is needed to force resin through the small holes. Insufficient pressure may result in inadequate resin penetration and weak attachment of the framework. Mesh construction also interfere with the arrangement of the prosthetic teeth. The ridge lap areas of the teeth may require significant reduction to facilitate proper arrangement. This compromises the aesthetic. These type of minor connectors can also be used for multiple teeth replacement. Nevertheless, open construction is preferred. The last category of denture-based minor connectors are used often in conjunction with metal denture bases. These fit directly against the underlying soft tissues. No relief wax is provided beneath these minor connectors. Resin is attached to the free surface of such bases, and retention is gained by encompassment of the surface projections. These projections may be created by placing resin beads on the wax pattern, investing them, and eliminating this pattern by heat application and casting the framework. Projection may also be created by adding soldering of irregular wire forms to the metal bases. The primary advantage of bead, nailhead, or wire constructions are that they provide relatively improved hygiene and thermal stimulation of the underlying surface tissue. The disadvantages include difficulty in adjusting and relining of the metal bases. Furthermore, the attachment of resin is relatively weak in these types of minor connectors. Hence, these should be limited to short span, tooth supported cast partial dentures alone. Let's take a moment to discuss the resin metal interface. A minor connector that supports an acrylic resin denture base must be joined to the major connector with sufficient bulk to avoid its fracture. Acrylic resin denture base must join the major connector in a smooth and even fashion. Any irregularities or step between the two surfaces will irritate the tongue. Acrylic resin is used to construct the overwhelming majority of the denture bases. Because resin gains its strength with increasing the bulk, it should not be finished to a thin edge. If it is attempted, the material may chip or fracture and can create unhygienic and potentially irritating condition. To prevent the acrylic resin from becoming too thin, the design of the resin metal interface should ideally be a butt joint and should be provided so the acrylic resin can blend evenly with the major connector. Because the resin is processed completely around the open and mesh type of denture base minor connector, the resin metal interface must be created on both the internal and external surfaces of the major connector. Whereas in the third category, that is the nail head type of minor connector, since the resin is only going to be on the outer surface, only an external finish line will suffice. These interfaces are referred to as the finish lines. If they are located on the outer surface of the major connector, they are called external finish line. If they are positioned on the inner or the tissue surfaces of the major connector, they are termed as internal finish lines. The internal finish lines are formed as a result of relief wax placed on the edentulous ridges of the master cast prior to its duplication. The waxes used are 24 to 26 gauge. These create an elevated area on the resultant refractory cast. The margins of the relief wax establish internal finish lines on the completed metal framework. The margins of these waxes should be sharp and well defined. External finish lines also must be sharp and should be slightly undercut to help lock the acrylic resin to the major connector. The internal angle formed at the junction of the major and the minor connectors should be less than 90 degrees. An external finish line is formed by placement and carving of wax during the framework fabrication. It should originate at the lingual extent of the rest seat and continue down to the lingual aspect of the minor connector. This should be well defined along its entire length, and it should be consistent with contours of the major connector. Transitions should be smooth and flowing. The finish line should follow an arc established by the lingual surfaces of the remaining teeth. The last and fourth category of minor connectors are those that serve as approach arms for vertical projection or bar type clasps. These are the only minor connectors that are not required to be rigid. These components support direct retainers that are clasps. Therefore, they must exhibit some degree of flexibility. These type of minor connectors approach the tooth from an apical direction. The approach arm should display a smooth, even taper from its origin to its terminus, and they must not cross a soft tissue undercut. To summarize, the first and foremost function of a minor connector is to join the remaining components of a cast partial denture to the major connector. Secondly, it is also responsible for distribution of applied forces to the supporting teeth and oral tissue. Therefore, it should be essentially rigid. This broad distribution of forces prevents any one tooth or any portion of the ridge from bearing destructive amount of stress. Lastly, there are 4 categories of minor connectors. First, which join the clasp assembly. Second, which join the indirect or auxiliary rest. Third, that join the denture bases. Fourth, that serve as approach arm. All of these connect these components to the major connector. Thank you. Please go through the reading material listed for additional information on the topic we discussed today.